Good morning. Happy Friday morning live. So, I'm talking to Black women today because it is Heart Month and it is Black History Month. And this is something that we don't often address. And truthfully, we're often told, eat less, move more, restrict more, stick to a guideline, and it leaves us really stuck and frustrated. And unfortunately, it ultimately does not have the impact we would like on our health. This is important. So, happy Friday morning. This is Friday Morning Live with Dr. Jenn. I help families and adults reverse metabolic disease using joyful medicine. Joyful medicine is where evidence-based lifestyle medicine meets real life humanity and joy. So thank you for joining me today. So we're going to get right into it because this is really an important topic. I think that we often overlook the effects of stress on life, and they really have an impact. And there have been several recent articles about this. And, we again often talk about just lose weight, move more, restrict more. You feel like you're not doing it right, or it's your fault. And it's really important to get away from this narrative because we have seen, the recent studies have shown that stress has a huge impact. It shows up in so many different ways. It is the effects of stress ultimately lead to shortened lifespan. And this goes across socioeconomic statuses. So often we talk about food and movement and other things, and we attribute it maybe to a, a a resource gap. And resource gap is definitely a problem. Food deserts are definitely a problem. But this ongoing stress, um, economic stress, this exposure to, systemic racism has a real effect on our life and longevity. And we know that socioeconomic status is not protective because we see it across communities and even in healthcare. Where being in healthcare is protective for male physicians, female physicians don't see that benefit. And it's even worse for Black female physicians. So it is a real problem. We have the highest mortality rate in spite of having education, income, access to care, and the knowledge, right? The medical knowledge. So doing everything right does not fully protect us. And it it's more than that, right? We often stress shows up in so many different ways. One of the ways that stress affects our body, we'll talk about that first and then move into why just focusing on lose weight, eat less, move more does not work. So stress can show up, it elevates our cortisol levels, which can, when it's elevated for a long period of time, it decreases heart rate variability, which means that our nervous system is in this chronic state of flight or fight, and that affects every organ in our body, and it doesn't allow us to recover fully ever. So even when we're sleeping, we're not resting because our body is in this state of heightened alert. And this sustained stressful response elevates inflammatory markers, which is what ultimately leads to the organ damage. It results in stiffening blood vessels, which can cause hypertension. It can make hypertension really difficult to manage. It can make it really brittle, increase our risk for stroke. It can increase our risk for heart disease. Cortisol also shifts how we store fat. It shifts it to the abdomen. It shifts to visceral fat. And visceral fat is the fat that causes increased inflammation. It also results in insulin resistance. It results in increased metabolic dysfunction. It results in fatty liver disease. It results in so many different things. Over time, this combination compounds. It causes this snowball effect where it worsens hypertension, causes hypertension, damages our heart. It worsens metabolic disease and ultimately leads to earlier death. So it's not about counting carbs. It's not about counting calories. It's not about discipline or willpower. I don't want to sound all doom and gloom, but because it's understanding what the cause is, understanding the underlying cause, so we can actually address the underlying cause and not just try to, you know, restrict or put it in a box or blame or feel shame or feel guilt. It's really so that we can really take control and understanding that the healing goes beyond medicine because often we are on medications, but we're still not seeing those same effects. The medications aren't having the same effects that they do have on other people because of this ongoing stress. And we need more medication, or the medication simply, doesn't have the effect that we want. And it's not addressing this inflammation and stress. So, what can we do? We need to start with how we feel in our bodies. And it's not about, self care that looks like, surface level self-care, not the manicures or, massages or, going out for a drink, which, all of those things can be helpful, but they are not really um, deep enough. We need to have the feeling of feeling safe in our bodies. And so it goes beyond just, often we feel like we manage stress by having a drink or going out and, which can be helpful, connecting with others. That's a really big one. That community is important and feeling safe and being able to share is important. But we need more. We things that I like to talk about are micro joy moments. Joy is truly healing. And it's it's not just, experiencing something lightly that's nice. It's really feeling it in your body. When you feel it in your body, I'm always talking about joy. When you feel it in your body, it actually does stimulate happy hormones, the opposite. It lowers cortisol, but it stimulates dopamine and oxytocin and the other just serotonin, and those one hormones that make us feel good, but also have a physiologic effect, just like cortisol can. These have the calming effect. Um, Things like mindfulness practices, like meditation, like a walk in nature, like breath work, all of these things can be powerful. Yoga. Therapy is something that we don't often take advantage of. Talking to somebody that understands and can support us is really important. So sometimes getting professional therapy help, community, being in community, which is really important. Being able to lean on others because we are social beings. We respond to being with others. So when we start there, the other changes that are important as well are more sustainable. We're more able to maintain them. We're more able to, in the moment, make a better decision. But it doesn't start with making that decision. The decision starts way before that moment happens. So sometimes you feel guilt because you ate maybe something that wasn't supportive of your health goals. But you know what? That's not it. The time doesn't happen the decision. The time happens before, when you had a stressful day, when you didn't have enough sleep, when you maybe didn't exercise to let off some steam, maybe you didn't connect. Those things happen before in the background. So we need to let go of the guilt. Also let go of the principle that it has to be this rigid, regimented, restrictive thing. I created my joyful medicine method specifically for this because lifestyle is meant to be lived. And I took it from the clues of the blue zones, where you look at where people live the longest, those areas around the world that were studied, but there's many areas around the world that capture this. And they're working to live, they're not living to work. And that's a big, big thing here. And they are being in community. They're taking time to eat with others and connect with others. They're walking and moving naturally. They're eating foods that are flavorful and whole foods that are flavorful and nourishing. They are sleeping well. They have low stress lives. And so, how can we recreate that within ourselves? And that's what I help people do with the joyful medicine method, focusing on joy first. When we capture joy and we lower stress, then we're able to make those other changes. So let's talk about those other changes, which are important as well. So when we talk about heart health, obviously I listed all of the things that have a negative effect, how cortisol and the chronic stress has a negative effect on our health, but other things are important as well. Restorative sleep. Sleep is so important. It's one of the things that I know I was guilty of in the past. I would say, oh, I only need 5 hours of sleep. I feel great. But you know what? Your body keeps score, because when we sleep, so much more happens than just rest, right? Our body, all of these reparative processes go on, and they help our body, you know, regenerate and be resilient. So sleep is really, really important. 7 to 9 hours a night. It needs to be restorative. If you have a problem with your sleep, something that really needs to be addressed. Sometimes a sleep study needs to be done, but really working on making sure that you are getting that full 7 to 9 hours of sleep every single night, as much as possible. Your body keeps score, and you cannot catch up. Joyful movement. I love to talk about joyful movement. I had a patient the other day that told me, she's like, I know I should go to the gym. I hate going to the gym, but I make myself go. If you're going through life feeling that way, that's definitely adding to your stress. So finding something that you love to do, maybe it is dancing, maybe it's walking, maybe it's playing a game, maybe it's jumping, whatever it is, finding some joyful movement. And even better, engineering your day with movement in mind, because that's one of the things is that we spend so much time sitting, as I am sitting here, but I do have my little walking pad over there. So thinking about where you can add more movement in your day. Maybe you're getting up and taking a walk in the middle of the day. Maybe you are walking to work. Maybe you're parking farther away, taking the stairs. All of those things help. So engineering that movement into your day is really important. um, Nourishing food. So I have to address this because it is easier to make supportive choices when you are in a resource state, right? I said that, like making a poor choice. The first thing is like it's progress, not perfection. All of these things, right? It's more powerful if you make a micro step. If you take a 10-minute walk, it is much better than doing one workout, a month, right? A 10-minute walk every day is so powerful. So looking at those micro steps to start with and building on them, right? So once you make the habit of doing that 10-minute walk, then you can add 5 more minutes, you can add 10 more minutes, you can build from there. You have to start somewhere, and giving ourselves grace and saying, okay, as long as I start, that's great, right? And be happy with that, because sometimes we have decades of habits that we are used to. We have decades of routine that we're used to. We've been eating a certain pattern for this long. So looking at those small steps that we can take, moving in the other direction is key, right? And not beating ourselves up about it. So I have to be clear about food, especially with all the mixed signals out there, even coming from the new guidelines from our government. So nourishing foods do not mean hitting protein goals. It does not mean full fat milk and dairy, full fat milk or meat. It actually, nourishing foods are making fruits and vegetables the star of your plate. That is, there is 1000% no doubt about this. Every single study shows that we are lacking in fiber, we're not lacking in protein. But when we eat more fruits and vegetables, we know in children, if they start and they're eating fruits and vegetables as children, they have lower risk of cancer. Anybody that increases their fruit and vegetable intake is going to improve their health. It's going to support a healthy weight. It supports your gut health. It supports your heart health. It supports your brain health. It lowers your risk of diabetes, including fruit and vegetables, both. So I really have to be clear about that. Fruits and vegetables should be the star of your plate. Right. I know I grew up with the vegetables as the side, right? The meat was the main dish, the main course, right? But it's the fruits and vegetables that we need to be building our meals around. So fruits and vegetables first. Whole grains, beans and legumes every single day. They are really powerful. They help, again, stabilize our blood sugar. They help lower cholesterol. They support a healthy weight. They support brain health, all of these things, nuts and seeds. And of course, flavor, because flavor is medicine. Herbs and spices are really powerful. They're really good for your gut. They are good for food. Food should taste good and be nourishing at the same time. I can't impress upon you enough how important that is. So healing is above medication, right? So I think that medications help, but when we talk about, especially as we look at these studies, the managing stress and focusing on this healing, feeling safe in our bodies is first. So that is the most important thing I have to say for today. When we talk about heart health, especially with Black women and our Black community in general, we focusing on our mental load is so important. So addressing the sources of stress, um, sleep deprivation and worsens it, chronic mental and emotional load, no doubt, dysregulated food environment. So all of these things compound, they act synergistically, they act negatively synergistically, but we can do the opposite. We can synergistically improve our health by improving all of these different factors. And again, starting slow, starting small. When we focus on these things, we really make a huge difference and lasting change. So again, it starts with how we feel in our life, how we feel about our health journey, how we feel in our life, how we feel safe in our community, experiencing joy, savoring life, savoring those moments in life and really feeling them in our body. When we are feeling regulated and supported, it is amazing how healing follows. I say this again and again. My program that I help the most people with is my Joyful Medicine Metabolic Reset, which helps women reverse diabetes. And I always start with joy. It is so important to feel comfortable in your body. And I see again and again and again, it's once we start letting go of these rigid, rigid ideas and embracing healing, embracing nourishing thoughts, embracing nourishing our mind and joy, that healing takes place. And one thing that we're always focused on is people always talk about weight loss, right? That's one of the things that in medicine, it is really the biggest topic that's talked about these days. But it doesn't start with, cutting calories. It starts with, again, feeling safe in your body. When you feel safe in your body, when you nourish your body, when you have restorative sleep, when you're connecting with others, when you're avoiding risky substances, when you are um, moving your body with joy, the weight comes off. So that is my message for today. If you are struggling with prediabetes or diabetes, I have a webinar coming up. I'll put the link in the description. If you are struggling with chronic disease, if you're feeling like you're not heard or you're in this box of restriction, and you want a better understanding, I do offer one-on-one coaching and also medicine if you're in New York and Vermont. So thank you for joining me. I will see you next Friday live at 9 a.m.